Oopsie doopsies. Whoopily doopily. There we go. Okay. So, today we're going to talk about the cranial meninges, which create anatomical compartments for bleeding to occur in the brain. And some of the compartments created by the cranial meninges are physiological or naturally occurring, and some are pathological. And so that means they're not there in health, but they're created typically by blood in trauma or disease. So we'll talk about first just the anatomy and how they relate to one another, and the skull and the brain. And then we will learn to predict the anatomical source and compartment and the stage of hemorrhage based on imaging and the clinical progression of signs and symptoms. So we are all in possession of a very large, heavy, gooey brain. And so some of the protective features are, of course, the skull and the meninges. Now, the skull itself is divided into cranial fossa. So these are on the inner surface, divide the skull into a frontal or anterior, middle, and posterior fossa. And you can see what's reflected. They're outlined here, sort of shaded in green, red, and blue. And then on the brain in this image, you can see which bits of brain sit in which fossae. So the green contains the frontal lobe. The middle fossa contains the inferior portion of the temporal lobes. And the posterior fossa contains subcortical structures, notably the cerebellum and the brainstem. And you can see how they fit into those bony spaces below. So that's the first division, the first compartmentalization of the large, very soft brain. And superimposed on that and attached to some of those bony ridges to further compartmentalize the brain are the cranial meninges. So the cranial meninges here, this is a superior or dorsal view of a cadaver, and it's been progressively dissected. So progressing from the scalp superficially to the subarachnoid space in the cerebral cortex, you can see all the layers of the cranial meninges. And starting at the scalp, if you recall from 326, immediately below the scalp is the epicranial aponeurosis, a dense fascial structure that gives attachment to muscles. In this case, this is the frontal belly of occipitofrontalis, that my cursor's on there. Deep to that, under some sort of, my pointer's lasting less and less time, I see. Under some loose connective tissue, deep to that, lies the skull. And so the skull, or the cranium, is obviously overlying and adjacent to the thickest, most superficial of the cranial meninges, the dura mater. And that in turn overlies the arachnoid. Now, when you peel them back in sort of schematized version, and I much prefer that pointer, but we will cope. When you pull them back in schematized version, you can see the layers of protection that are created. And so we have the skin superficial to that connective tissue layer, in turn superficial to the periosteal tissue, which overlies the skull. And remember that the skull is a diplo, so it has a table of compact bone, spongy bone, and another table of compact bone. And all of those layers overlie the cranial meninges. So deep to the bone is the dura mater, and the dura mater arises in two layers, the periosteal layer and the meningeal layer. And where those two layers come apart, that creates the dural sinuses. So they separate. So here we're looking at the superior sagittal sinus in cross-section. And the superior sagittal sinus occurs because the periosteal layer of the dura mater tents over the sagittal sulcus, while the meningeal layer dives in to the sagittal sulcus. And the space that they create between them is the superior sagittal sinus, creating venous blood. And so again, we have the periosteal layer and the meningeal layer of the dura mater. And deep in turn to those two layers, you'll remember there's a collective term for these meninges, the arachnoid and the pia, and collectively they form the leptomeninges. So the term is leptomeninges. I can maybe type that on a slide to make it look a little better, because I don't have a good whiteboard. Okay. And so, great. And so the leptomeninges is a collective term for the arachnoid and the pia. And there's a naturally occurring space deep to the arachnoid mater, which is of course the subarachnoid space. And the subarachnoid space contains both CSF, cerebrospinal fluid, and the majority of the vessels that supply the cerebral cortex. So for example, we talked already about the superior and inferior branches of the third division of the middle cerebral artery. Those largely travel within the subarachnoid space. So they are contained within the leptomeninges. And finally, the pia, which clings to the surface of the cerebral cortex. And the pia mater is the deepest and most delicate of all of these. A couple of things, again, to note about this slide. So this slide's really important because it's reminding you of all of the order of the cranial meninges, but also of the relative position of compartments they contain. So for example, looking at the center of the slide here, we have the superior sagittal sinus, which contains venous blood, and that's anatomically separate from the subarachnoid space, which contains the vasculature and the CSF, or cerebrospinal fluid. And the only juncture between those is functional. We'll talk more about this, the arachnoid granulations. So these are outcroppings of the leptomeninges. And in fact, they're just peel outcroppings within the sinuses. And they are one-way valves. So they let CSF pass from the subarachnoid space into the superior sagittal sinus, but not the other way, when all is functioning properly. And here's what they look like again. And so this is another cadaveric dissection. This is the frontal lobe here. So the anterior side of the brain is on the left side of this image. And we're looking at the left hemisphere because this is the front of the brain. And you can see, even in dissection, the space, this time in longitudinal section, of that superior sagittal sinus. So here it is captured in a real cadaver, the space between the periosteal dura superficially and the meningeal dura deeply, and that corresponds to this cross section or coronal section, of the superior sagittal sinus. And so here we're seeing it in sagittal section. And again, you can see how thick the dura is, and the arachnoid is intact over this surface of the left cerebral cortex. And we know that because all of the vasculature is filling the sulci. And so we know that overlying that is the arachnoid. If we want to look really, really close, this is a scanning electron micrograph of the cranial meninges. This happens to be in a dog. And so in this gives you a relative idea of the position and thickness of things. So this, under scanning electron microscopy, struggle is real. This is the dura mater, and you can see how thick that is compared to the arachnoid and the pia. And the pia is actually here, if I wasn't clear there, clinging right to the surface of the cerebral cortex. This is an arachnoid trabecula, and so this subarachnoid space is real. That is faithful to what happens in the intact brain, whereas this space here between the dura mater and the arachnoid is an artifact of sample processing. So this is not a naturally occurring physiological space. So as we've said, the dura consists of two very tough outer fibrous layers, and the outer periosteal layer sticks right to the inner surface of the skull. And as I've said, it's fused to this inner layer in all of the places except where they separate to create the venous sinuses. And the two main places this occurs is first within the false cerebri, which is this sheet of dura that's suspended from the roof from the roof of the cranium, separating the left and right cerebral hemispheres. And the second is the tentorium cerebelli, which is, as the name suggests, the tent of the double-layered sheet of dura that covers the cerebellum superiorly. So I thought I would take advantage of the fact that I'm sitting in the anatomy lab to remind you about Creepy Pink Head. Hello. So Creepy Pink Head is our model, of course, for these dural folds creating the dural sinuses. And so the two main ones, as you might recall, are visible in this first in this lateral view, which we can see the false cerebri quite nicely in. And so remember that the false cerebri is here, and that's a representation of that. If you look at the Creepy Pink Head end on, you see it's in the mid-sagittal plane. Looks extra creepy on camera. Hello. And then attached to it, oh gosh, there we go, is the Tentorium cerebelli. So now, if you remember, you're looking at it in an inferior view. So from the cerebellum up, and at the juncture of those two, it creates the straight sinus. All right. So, this is a cadaver dissection with the false cerebri popped out from between the cerebral hemispheres. And so this is the anterior or rostral side of the false cerebri. This is the posterior or caudal side. And you can see that, again, it's narrower anteriorly and widens posteriorly. If you look down on the base of the skull, this is what you see with the brainstem in position. And so this space in the Tentorium cerebelli, so here the false cerebri has been pulled back out of the way, as it has been here. The cerebral hemispheres have been removed bilaterally, and we're looking down on the cranial vault. So I guess we'd be looking kind of at this view. So if we're in that view, you can see in the middle is the visible surface of the transected pons and the cerebellum posterior to it. And then the Tentorium cerebelli surrounds that. And the Tentorium cerebelli contains, obviously, the space through which the brainstem attaches to the brain. And this space with the superior midbrain removed, or the midbrain removed, so that we are looking down on the pons, is called the tentorial notch, or the tentorial incisure. And you'll see that it's a really important clinical opening. And so the midbrain, just so we all know where we are, obviously connects the cerebral hemispheres with the rest of the brainstem. And this is the view you just had. So actually this is a bit rostral to that, because the midbrain is still here. It's popping up through the tentorial incisure. And I can tell I'm in the midbrain here. I'll give you a few landmarks. So there's a consciousness center in the midbrain, the reticular formation, and Sam will talk about that as we get into sleep and consciousness. Here are the borders of the tentorial notch surrounding this opening as the brainstem pops up through. And anteriorly in this space, you can see the ocular motor nerve, cranial nerve 3, entering the midbrain, and it enters the ventral or anterior surface of the midbrain. And then immediately adjacent to this opening is the basilar artery that's traveling, remember, through the foramen magnum and branching at this level to give rise to the posterior cerebral arteries bilaterally. So you have all of this going on at the level of the tentorial incisure. You have cranial nerve 3 entering the midbrain. You have posterior cerebral arteries entering, the basilar artery entering and branching to give rise to the posterior cerebral arteries. And you have critical brainstem nuclei, including the reticular formation at this level. If we look at a CT at approximately this level, you can see the midbrain, which I'm looking at in the center here. And you can also see the cerebral peduncle. Now the cerebral peduncle, I didn't mention. The cerebral peduncle is the mass of white matter that connects the cerebral cortices. So there's a cerebral peduncle on each side, left and right, and the cerebral peduncles connect the cerebrum to the brainstem. And so they are located at the anterior surface of the midbrain bilaterally. Now I know this is a CT, hopefully you do too, for a couple of reasons. It's very obvious to me given the density relationships in the image. So I'm looking at a very, very bright hyperdense skull compared to hypodense and generally poorly defined cortical and cerebellar tissue. So the soft tissue is much less dense than the bone, and that relationship is obvious. I can also see that the least dense or most hypodense areas are spaces in the brain, like the Sylvian fissure, for example. You can see that the level that this is cut at shows you the midbrain lying within the tentorial incisure. A little bit more inferiorly shows us another really important clinical opening, and we've already mentioned it. So it's the spinal cord medullary junction, and it's lying within the foramen magnum. So these are two openings that you don't want to get sort of mixed up or interchanged in your brain. So I want you to look at these two schematics and remember that this one's way up here. This is the opening in the Tentorium cerebelli. So this is an opening in dural folds, whereas the foramen magnum is an opening in the base of the skull that admits the spinal cord. This is right at the level of the spinal cord medullary junction, and it's surrounded by CSF, and then the foramen magnum is this big. So the foramen magnum, the hypodense CSF, and then the slightly brighter or slightly hyperdense CNS tissue. And you can see the air and the maxillary sinus which is isodense with the air around the patient. So the tentorium cerebelli separates the superior surface of the cerebellum from the occipital and temporal lobes. And so that defines supratentorial compartments and infratentorial compartments. And if you look at the shape of the tentorium cerebelli, it looks like the wings of this bird. And that's why the bird's there. So the bird wings are sort of swoopy like this. And that's the shape of the tentorium cerebelli. And so again, the compartments are supra, or above the tentorium cerebelli, and infra, or below the tentorium cerebelli. And so the whole contents of the infratentorial compartment in health, provided there's no buildup of pressure in the brain and displacement of contents in the cranial vault, most of the infratentorial compartment is cerebellar, ideally, as well as a little bit of the brainstem occupying that posterior fossa. This is a very, very superior axial MRI, and it shows you a couple of things. So I can see, of course, the thick table of the skull and this sort of top of the head chopped off image. I can see the false cerebri clearly separating the two cerebral hemispheres, left and right. And it's just showing you the normal hemispheres as they appear in the left and right supratentorial compartments. A coronal MRI, you can see also the dural reflections and how things should look normally. So this is, everything is going well, there is no weird pressure buildup in the brain, and so this is what things should look like. The false cerebri is centered on the midline in this coronal section. The tentorium cerebelli is symmetrical and divides the cerebrum in the supratentorial compartment from the cerebellum in the infratentorial compartment. And here we are in the lateral ventricles. We can see that these little bright bits of choroid plexus are calcified, and that happens normally with age. So that's a normal symmetrical appearance of the lateral ventricles. And finally, in a sagittal MRI, you've got a clear division at the level of the tentorium cerebelli, dividing supratentorial from infratentorial. And it's really important to have all of this normal arrangement of the brain in your head in all three imaging planes, so that when you see the brain being pressured or deflected in one direction or the other, you can sort that out.